short. I'm going to ask the panelists to introduce yourself, talk a little bit about who you are, what your organizations do, and specifically what your involvement in Ukraine is right now. I will start off by saying that according to the Ministry of Health, the number of patients complaining of mental health has doubled since 2023, in just a year. And the use of antidepressant sales have also increased by 50% since 2021. There have been a number of studies that have suggested that more than 50% of the Ukrainians all Ukrainians are suffering from PTSD, and so these are some severe issues that we're all going to have to deal with. I'm again going to ask you to try to keep your remarks about 10 minutes, because I would like to ask a few questions of all of you. Questions I'll ask you, and then maybe from the audience we'll have some questions as well. So, please.
So hello, dzień dobry wszystkim. My name is Kateryna Savytska, and I'm a representative of Ukrainian Psychological Association. From the start of the war, the first months, I changed my location to Poland and start my work with refugee center. I have 3 master's degree. It's psychological, law, and international relationships. And when we started to control and to coordinate a refugee center, it was one of the hardest stuff, because at the same place there were living about thousands of refugees, which were really very broken, and we had to find some structure, how to help them, how to create some documents, to set boundaries. And one of the questions was with psychology how, that all they were frozen. Like they were telling me that when the war will end, then we will start to work, to do something, and now we are just like waiting for the end. And for me it was very important to tell them that but the war can be for 1 year or 2. And if you are idealizing Ukraine, that when you will come back it will be like fairy tale, you have to understand that you have to build yourself and to come such personality which will rebuild Ukraine once more. And it helped because they start to do some work, to search something, just like it was really very hard experience. And the thousands of people were at our refugee center. So we were just building like micro society, and such experience is very useful for the future. And what I want to tell that now we are speaking not about individual trauma, it's like collective trauma of all society. And what is the difference? The difference is that collective trauma don't have boundaries of the territory and of the time. What I mean, for example, the people which live in Ukraine and have the trauma of the war, they're not only the only one victims. We are speaking about even people which are living abroad, which also are traumatized. And not only Ukrainian society, which is very similar as Polish people, because all they are scared what will be if the war will continue and be in Poland. And another one moment about collective war is that you don't have time. For example, if we are speaking about collective individual trauma, for example rape, it was made once in life and it just like ended, and we can work with consequences. But the collective trauma is going to the next generation, not only one, it can be going next and next. So we have to understand the scale of what is going, and it has to be for us to understand that we will have many challenging at the future. So it will be like depression, PTSD, panic attacks, losing the safety. And we have to understand that also will be the changing of the roles in Ukrainian society, because many men will be not live, they cannot do many work, and so the women have to take the men roles, and they have to be ready for this. The next thing is that studies have to be some studies for psychologists, some programs which we have to prepare now, because many psychologists have to be better qualified to giving psychological help. And in the scale of the trauma, I want to tell that there have to be different programs, and we have to understand to whom we are giving our psychological help. Because, for example, if we are speaking about refugees abroad, it's one type of person which we are giving help, and another is people in Ukraine. It's another program and another style of helping. And if we are speaking about refugees abroad, that's also two types of groups which have different helping. One, people which want to stay at that country and we have to help integrate, and another which wants to come back to Ukraine and to live there. We have to prepare. And another very important thing is about Ukraine. People which live there, because there is civilians which have to psychological help in one way, and soldiers and their families which have another very hard moments now, and we have to work with them. So the best what we can do now is to prepare our psychological workers, and then to create program, two types. One, when the war is continuing, because when the war is not ended, the trauma is, we cannot work with trauma healing. We can work only with stabilizing. And it's different type of people. Stabilizing when you're living in Poland, in the United States, and when you live in Ukraine. And when the war will end, our psychologists have to know and to have the programs and the steps what to do with people next. So it will be not easier, but we have to now to plan what to do next, to realize and to have the best what we can do for people. And also, at the end, I want to tell about the psychological portrait of the society of Russia very shortly, because the Russian identity is very narcissistic, and it's in its historical background, it's the empire, the greatness, and the Russian national anthem is about that they are sacred, powerful, and great. And the national anthem of Ukraine is not to die and to have the freedom. So if you will see these two anthems, you will see the different identity of different countries. And Russia ideology is to build a mystical, is to answer that there are some mystical attacks of the West, and the fight strategy is a living strategy of the society. And when we won't stop it, it's like a criminal which has not been stopped, and he increases the scale of his crimes. So we have to understand what to do to stop Russia the next. It's very important. Thank you.
Sure. Hi everyone, my name is Anna. I'm Chief Development Officer at SpivDiia Charity Foundation. It's Ukrainian non-governmental organizations that launched in March 2022. So we are that grassroots organization from Ukraine that are providing support for more than 3 million people, as my colleague already mentioned. But I would focus that we are doing in Ukraine in a comprehensive approach with ecosystem of services for people, beginning from the humanitarian assistance till the career counseling to help them to find a job and to be sure that they are self-sufficient. And that's one of the main goals that we are doing with our strategy, to find a way how to be sure that Ukrainians can get everything that they need and become self-sufficient nation and not depend on the even international support. And at that point, mental health is the first step, is first touch to people, because if they are not ready and they are not feel really well, they can't get any assistance that we will provide and get any assistance that you will provide with your organization. So from the very beginning, we've covered more than 160,000 kids in Ukraine with MHPSS services and around 16,000 services for psychological counseling for adults. I have different thoughts regarding that, but I would like to mention a couple of things that I think it's important for you to hear. In Ukraine, we don't have this, culture of mental health things. Like, it's really come only because of the war, I would say, because people have a lot of different mental health stigma, and it's really stigmatized thing because you're not ready to seek for help, and additionally to seek for help, especially if you were suffered because of the war stuff, if you lost your loved ones, or if you you were internally displaced. For them, it's just hard to come to the space and say, I need your help. And we saw it a lot of times. That's why we started from the humanitarian assistance, when people are really would like to have something to their hand. So they are getting this box of food, or doesn't matter what it is. And after that, with case management approach, we are trying to provide them opportunity. Okay, maybe you would like to see any areas of needs that could be helping with your psychological support, or any other things. And due to our data, only 25% of whole beneficiaries that we have are ready to get the psychological counseling. And we are not just providing it by individual consultation, we also doing like our therapy session, group session, all this stuff. And in our opinion, like people that are living especially in rural areas, for them it just, they don't get any of the services, right? But what we also saw, and due to different data and researches that we see, the most vulnerable category of Ukrainians is children and youth. 28% of youth are asking for psychological support, but only 12% of this 28 are really committed that they are ready to take it. And at that point, we also had a different strategy to provide such type of services in youth centers where they feel this safety atmosphere and youth can come. But at the same time, we get used to things that youth is like up to 25. But in Ukrainian legislation, youth is still 35 years old. And from 25 to 35, almost like 70% of this category of people, they have kids. That means that it's like adults that have families, and they need comprehensive approach with support that should be given not only from the government side, which everyone is expecting, but also from the non-profit sector, like civil society organization. And this is our role in the point of view where we can provide assistance that we have capacity to, but also another part of question is that how to coordinate all these efforts, because I'm just Ukrainian, I live in Kyiv. Every night, for the last 2 months, every night I heard how the drones are going through my home. And like every night I'm just waking up and like know that, okay, in the morning I should go for work, and I also need mental health support. And I guess in the world, like every country right now is talking about mindfulness, all the things, because everyone needs support. And this strong commitment, like from my side, to help myself, but I should be ready for this assistance. So I guess maybe we will discuss further some of the things that could happen, could help to cover all these needs. But my main message would be that, in my opinion, each person who lives in Ukraine, doesn't matter adult or kid, everyone needs mental health assistance, and in different level, and it should be covered not just by specifically programs. For example, in Ukraine we have a program How Are You from the First Lady of Ukraine, Dmytriv-Kapeniak, and we are partner of this national program, and we see that as much we can get this support to people on the ground, it will be much better to get these consequences, which are my previous colleague was mentioned, for a future generation. So, thank you.
Thank you. Mariya?
Hello, my name is Mariya Dmytriv-Kapeniak. I'm actually from here, from Chicago, currently, but I went to medical school in Ukraine back in late 90s. And I'm also a family physician, and I practice here, and I'm a global health professional. I'm representing Ukrainian Medical Associations of North America, as well as Ukrainian Congress Committee, which is the largest advocacy organization. I think there's a lot of parallels that have to be drawn and are drawn between the medical help and policies. That's why I think we need both. We need advocacy and we need help on the ground. But I think I'm in a unique position to speak on behalf of both worlds, because I was born in Ukraine, I went to school in Ukraine. My friends that are now working in Ukraine, I get information from the first hands what really is going on at the battlefield as well as in the society. I'm trying to objectively kind of look at the big picture. Also in here in Chicago specifically, we have about 30,000 new people that came as war refugee with it's called W4UA program, which Biden's administration implemented to sponsor people that wanted to escape the war and had relatives in Chicago. So there are mental health programs that are available for them as well. But almost everyone, either here or in Ukraine, have someone that they either lost or know someone that they lost or were injured in one way or another. So yes, this is a nation that's under huge mental health trauma. I just did a presentation for American Public Health Association specifically on women's health during the war and the impact of that. And basically, at the start of the first day of war, Ukrainian women had three choices: either take arms and and join the army, or escape because they were able that they could go across the border to Poland and neighboring countries and become a refugee in other countries. Or some of them actually left their children and sent children unattended, and some had elderly parents that they had to stay with. So there are difficult choices that needed to be made. And there are a lot of stories, and there's a lot of like systemic impact that all of those three divisions, all of those three directions have made, and I think overall impact on mental health as a global development, as a global science. I think what is studied the most now is the resilience factor, like how people are still surviving, how people are still going on with their daily lives. And I think there was a study, I think it was by UNICEF, that about 70% of Ukrainians have some kind of mental health trauma, and about over 40 are actually very, very resilient. And specifically, women took on a lot of leadership positions for various reasons, including as a diplomat, as the ambassadors in different countries, including First Lady Olena Zelenska, who started a lot of different initiatives, and again, specifically the How Are You project is very powerful and has a lot of tractions. And I think researchers from all over the world will be using the data and helping, hopefully, in other countries as well with developing different mental health programs. But yeah, there's one of my favorites. One is the Veteranka, which helps women veterans to reintegrate back to life after being at the battlefield. There's also a program for kids that lost their parents in the war, and that is also a huge segment. I don't know how many hundreds of thousands of those, but they will need a special support and special programs. And it is important to look at it again. There are a lot of individual foundations that are doing great work. And we have to look at it from different perspectives. Who should be funding it? Who should be doing it? Should it be Ukrainian government? Should it be NGOs that are responsible for it? Maybe academic institutions, maybe faith organizations, maybe both, like Ukrainian Catholic Foundation, which is also the academic setting and also faith-based. So there are a lot of, I think there's room for all of the projects and nurturing everyone's ideas that are great, and they're directed at helping specific segments of the population. And I think that in the future we're going to have a lot of research and a lot of positive impact, specifically about resilience and all the great work that you guys are doing here. Thank you.
Thank you very much, Mariya. You mentioned, actually, when you were talking about a lot of individual organizations doing wonderful work, and you mentioned coordination, right? So my question, I'm going to start out with a question, and then we'll go to the audience if there's questions from the audience. But first, let me ask you this. What are you doing, what are all of you doing in terms of coordination? What are you doing to help coordinate? Look, there's going to be more need than there are resources in Ukraine. We'll never be able to find enough resources to address the need. So coordination becomes even more important. So what are you all doing specifically? And then secondly, to add on to that, what would you like to see done in terms of coordination? So who would like to start?
Yeah, I can go ahead. There's definitely part for government, for Ministry of Health to be involved in it. But I think it's really grassroots efforts that the organizations like yours and Ukrainian Medical Association and UCU, and I think we're already partnering on different projects. And Veteranius, actually, by Marta Farion is here. I think you're also involved with the Health of the Veterans program with the Kiev Mohila Foundation. So again, many of us here are already involved in different projects, and it really helps to know people who do similar things, and events like this really help coordination. But who will take the leading role? I think it could be some kind of council that made up of leading NGOs and governmental representatives.
You mentioned the Ministry of Health, but when you think about mental wellness, it's not just about a doctor, it's not just about medication, it's also about employment. It's about putting a roof over your head, right? It's about being able to provide for your family. It's about being part of your community. It's about giving back at the local level. So what does that look like, right? How is it that we can get Ukraine to coordinate their efforts at not just the federal level from the president's office, but also from the local level, the mayor's office? Maybe you want to take a shot at that?
I would like to directly answer most of the question. What we are doing. So I would say, like, really honestly, at the beginning of the war, we had 23 psychologists in 23 regions of Ukraine. Right now we have 8, because we see that we don't want to duplicate any efforts that are already existing in a specific region where, for example, such organizations and NGOs like Dmytriv-Kapeniak or like SpivDiia, any other Ukrainian non-profit organizations that already provided this assistance for a specific region. This means that we as a SpivDiia don't need to be there because it's already like organizations who are doing it. Also, one of the coordination roles that are doing this How Are You project, if you are providing the psychological and mental health assistance, you should be coordinated on this national program, and you'd also report into that, and there see who and what are doing in a specific region, areas, territories, etc. If you are talking about like MHPSS services, also we are, for example, part of the UN cluster, education cluster and child protection, so we also report into like UN agencies to show that we as a like grassroots organization are covering and implementing some activities for kids in this region. And when, for example, we have right now a program with UNICEF and other donors are coming to us and saying, let's make this in Kharkivska region. And we have in Kharkivska region 40 TLC centers for kids where we are doing catch-up classes and MHPSC services. And we are saying to donors, say, please not invest in it because it's already open. And like you don't need to put your money where exists like everything is like almost covered, right? So that's, I guess, what it should be, that each of us should take own responsibility to be sure that we are really honest about needs. We have the data, what is going on the ground, really covering things that are not covered by other organizations. And coordination is where I am as a SpivDiia can come to any other participants here and just to know what they're doing and maybe some mapping and informational like things that could exist. It's not always about government side, but it could be even some NGOs that would like to make the consortium of specific organization to take this mapping off and to provide this information from everyone who are doing something in mental health. So that would be our point of view. Thank you.
And as a psychologist and psychotherapist, we are doing such initiative which is not registered, but we are meeting with each other just like by online and speaking about what experience we have. And also we are creating like in Facebook and Instagram everywhere like platforms where people can search us, like such platform as Paramoha. And it's like without anything from the law side, we are just like our initiative which is for free, and we all of psychologists and psychotherapists give some free time when we spend it and give some free consultations and helping. And it is about, it's about from 3 to 10 consultations per one person. It depends how a person needed. So it's about initiative in Ukraine and also in Poland. So it's what we are doing in our professional level.
Mariya, do you have something like that?
I lost my train of thought, but I think it is back to coordinating on a global level, and I think now these days that we're just talking about it, it's so easy to communicate with all the technology that we have in hands. For example, when the war started, the Ukrainian Medical Associations did this telehealth project where we delivered over 70,000 telehealth visits to Ukrainians, and this is from the whole North America, US, and Canada. So you can be there in Toronto, Canada, and then deliver mental health help if you want, if you can. And it doesn't necessarily have to be like medical doctor, psychiatrist. It could be peer-to-peer. It could be support group just on a similar trauma and so on. But who should be in charge of this whole coordination? I think it's important to grow projects, and then with time we can see which one is successful, which one is not, and then of course collect the data, and then that's how we can move forward. Who can do this best?
Now that top-down approach that you just mentioned on the global aspect, that's great, but I continually hear not just about mental wellness, but I also hear about other resources from the local level, and that the local level is not getting the resources that the national level has. I mean, what are your thoughts on how do you fix that? What your thoughts are, what's missing? I mean, you must have some specific ideas.
On a local level, it's just a lot of just everyday trauma. So what's missing is peace, right? And I think at first you have to give people food and shelter, and then you can think about the second layer, which is mental health. It's a flight or fight reaction at first, right? So once you're out of that chronic stress, then you can think about, I think, the peer group, the support groups would be very good at the local level because everyone knows each other, and then people are friends and co-workers. So I think that's one of the initiatives that could be maybe more helpful and more developed at the local level. In terms of resources, it's mental health's always been underfunded throughout the world, not just in Ukraine. So it's, again, there's a lot of donations, there's a lot of donors that are interested in helping. Even specific vulnerable groups. I was just asked if I know community in Ukraine, specifically for LGBT, that they wanted to donate just to support that particular group. So yes, there's a lot of donors. We need to do a lot of outreach. But yeah, local communities will have to organize themselves and maybe around the hospitals or mental health professionals in the future.
And also the question is that when psychologists are making consultations, the people which have to find sponsors is another. That's why we don't have time to consult and to find somebody. So we have to organize maybe better to have some workers which will help us to find sponsors. Because when you are consulting from 8 till 10 at the evening, you don't have any power to write to somebody or just to do something more. We are doing what we can do the best by the individuals and creating groups as professionals. Even if you will see the website of every association of psychologists, psychotherapists, you will see that there is always a field that you can have some free consultations. If you need it, just call. So what we have done in our level.
Great, thank you very much. So why don't we go out to the audience with questions? Are there any questions that you'd like to ask our panel on mental wellness in Ukraine? Please.
Two questions. One is, in the United States, the U.S. government is a major provider of these things, but there are also a lot of private networks. For PTSD, the largest private network is the Killing Veterans Network. Are you familiar with their work? Okay, I'll give you my card. I'll make an introduction for you. I mean, hundreds of millions of dollars. So that could be very interesting as a model for what could take place in Ukraine. The second thing is, it seems to me access to mental health services in Ukraine is challenging, right? And physically challenging. Like, how do I get to a therapist? And that the telehealth model that is developed in the U.S. might have applicability in Ukraine as well. And I might have a view on that as well. Those aren't questions, sorry.
Yeah, but maybe I can just brief answer regarding our approach, so what we are doing. So we have online hotline phone because if people don't get the access to the internet in rural areas, they will never know about services that we are doing in big cities, right, in big communities. So that's why we're working with local authorities and spreading the information regarding these hotlines to people who can just have their phone and call and ask for help. The second thing is that when we are distributing humanitarian assistance, we are putting just papers, leaflets, and saying that, look, here what you can get also if you need it, if you can just have this call. But if, for example, we have this service really based on the like hub where we are providing all the ecosystem, that's easier for people really to come physically, but it doesn't work because people are scared to come and say, I need your help. And this is what I talk about, this mental health stigma, but yeah, we would be really happy to know about the approach that you mentioned. Thank you.
I have a question about this. For example, here in the United States, psychological therapy is very popular. People, it's a normal thing just to go to a therapist and talk to him, and particularly because mostly it covers with your health insurance. In Ukraine, people, as far as I know, people are not used to turn to psychologists, and some people are still getting confused between psychiatrists and psychologists. So, do you do any work that actually popularizes this type of service?
And before you answer that, because that's a great lead into the question I'm going to be asking, and so while we know that tracking mental health issues is equally important in any country, including the United States, under the circumstances using international guidelines, we're also realizing that today, when Ukraine is in the third year of this full-scale war, a totally different approach to handling mental health issues must be used, right? So that means that the Ukrainian mental health experts are challenged to really appeal to the approach that Ukrainians have never really seen since World War II, right? So please, to add on to what you've said and answer that question, but what are you doing, or what have you seen that is specifically addressing these issues that are unique to Ukraine since the war started?
I have 5 cents on that. Interestingly enough, again, I see a lot of patients here that came from Ukraine within the past 2 years. A lot of them talk to psychologists back at home. Even though they have health insurance here, but it's easier for them to connect with their psychologist over Skype or FaceTime, and they have scheduled sessions. So, because therapists here might not understand their problems, and of course the language barrier. So I think, again, the development is huge in Ukrainian resources and in Ukrainian knowledge. But telehealth is really, I think, the way to do it, so you can connect to right people.
I would add 2 things. First one is that we really don't see any changes. Like, it's really hard to provide this assistance to people because all of them are need, but they're not ready, right? So we, even in our organization, we try to do this like circle of support. To say is that we invited psychologists for just a group session, just to talk about love or inspiration. And they maybe not ready to understand that this is psychological assistance, but they are ready for some interaction with other colleagues. And we use also kind of this approach in community level. And I believe that community-based approach in psychological support in Ukraine is one of the main stuff that we should be focused on, because if you're ready to share your experience with person who are close to you, with your peers, then for you it will be easier to be ready for changes or for external support that you may be not ready to say directly and ask for this help. So, and we are trying to ask people to come for group sessions, like art therapy session. And after that, when they feel more relaxed, calming, only then we are providing them this individual consultation. And this is a project that in our organization on local level is really working right now. But I'm not sure that it's really good approach for nationwide activities in this field. It's just our point of view, so that would be my answer.
And in Poland, it was in another way, because people at first they were going to NGOs to have home and eat. And when the NGOs give them this to them, then it was like a safe person for them, because when they run from Ukraine, it was like losing everything. And they are searching for some stabilized person, stabilized NGO with whom they feel safety. And when they have this stuff, then we work in groups. Like I'm a psychologist, somebody help us home, somebody help us eat, and they were speaking with them like, we have psychologists, It can be very useful if you will go there, but if you don't want, it's also okay. And then the people start coming because it was like a community at one NGO as the same refugees are coming. And when came one refugee and she just said, well, I feel really much more better. And if they are at the one, for example, hotel, they start communicating and then it becomes growing. When I come to refugee center at first like psychologists, they were watching at me very scary because they think that when you are going to psychotherapist, you are crazy. They don't understand that it's okay. And then for me, my colleague tell me they have to go to you. I said, we cannot push. They have to go by themselves. And I will come once, 2 times, 3 times. They have to feel that I'm a safe person, I'm warm, I'm not pushing on them that you have to come to me. And I was coming just like having dinner with them, speaking with them, finding communication, without any speaking about problems like how do you feel, what do you think, but not speaking about the war. Because before working with refugees, all psychologists have to have education, that you can't speak with them by yourself. What is your home, where are you from, etc. Because we have some evidence, accident, that one psychotherapist come and she starts speaking. What home do you have? What is the table there? What is the chair? Like coming back to the traumatic experience. And after this, about 2 months, I had to stabilize all center because people become crazy because they tell, but I don't have no home. Everything is bombed. What I have to tell her. And sometimes people which don't have education working with refugees, they don't understand red flags, which you cannot go there. If the refugee is speaking, it's okay, because she wants to share it with you. But if she or he is not speaking, you cannot go there because you can re-traumatize so much that it will be much more harder to work there next. So if I'm speaking about Poland and how it was in refugee centers and in NGOs, the first is you have to be a safe person, and then when they believe you, they will come to you.
Please. Could you just say, I should ask you to just say your name and maybe the organization you're with, just so we know you're coming from.
Hello everyone, my name is Igor. My organization, I'm a co-founder of charity organization Rescue Now. So, with the challenge today, do you think online or offline support works better for mental health for children and adults? And what new ideas or methods in this area already work well?
I can start. Thank you. Great question. And I'm thinking that it is very important to kind of, I don't know if specialize is the right word, but to bring people with similar trauma together. I know there is a saying among Vietnam veterans that you'll know, you only will know what we're talking about if you've been there. So there are children that are victims of rape, there are women that are veterans, there are men that are veterans, there are those that lost someone. And I think it's important not to try to do everything at once. Just kind of with any charity, any project, if you pick it, you learn on it as you learn more and more. Same thing with the specific fields and specific mental health trauma. It's hard to generalize. So I think, again, telehealth or in person, but it would be good to kind of split it into different areas, different categories.
Due to our data, so mostly adults are asking for online consultation for psychological support, but especially for kids, we are not providing online approach with any other counselors for kids, and we will always work with them only in offline format. If it's especially if it's frontline areas, we are doing the shelters or DLC centers underground because it's like due to safety and security reasons, and we provide an all psycho-emotional program for support, catch-up classes, all things that are doing. We everything doing only offline. We had one negotiation with some partner regarding online PSS program. And to be honest, we are right now doing the research and we are not sure that it would work well because in our perspective, the best the best personal relationships that are built in between kids that are really defending themselves and they are really live in hard situation. They won't be ready to be open for any adults that are providing them many activities online. But it's specifically regarding the frontline area where we are doing this all kids program. So I would recommend that if it's children program, it should be doing offline, and also it should be really trained staff. It should be psychologists involved, because we had experience when we provided MHPSS services, like psycho-emotional program without psychologists, and then we make a big pivot and add psychologists into the team, and we see that emotional stabilization of kids that also were supported by psychologists just by small interaction with the program, it's much better. So that's what we see on the ground. Thank you.
I agree with my colleague about children, because to work with them offline is much more better than online. Online it's not working truly. And about methods, about what you were asking, most refugees are frozen inside. What we have after the Second War is a called society, they're called women, because to deal with emotions, you have to just separate with this. And in my practice, refugees don't want to speak too much, because for them it's about pain. And then you're working with imagination, and with art, like painting something. To me came one woman which don't speak anything, and she said, I came to you, I feel better, very bad. I don't want to tell you anything, but I feel really inside something is going. And she was only drawing me, and I was telling, I see that here can be this, just like it's trained about 4 years psychotherapy, education. And after 5-hour session, she said, you know, it's the best what can be, that I don't have to tell any word, you read everything, and you feel my emotion. But the main is, when you work with refugee, you have to work with your heart. You have to feel these people. You have to understand the pain in their eyes. And also what I see is that psychotherapists which live in Ukraine, they are the best to work with refugees or people in Ukraine. But if you have this experience of changing country, the best is for you to work with refugees just abroad. Then you understand all their pain without any word. Because when we were speaking with psychologists, and I asked some questions like client cases, what will you do with clients abroad, they don't understand. So this experience, for example, for me like a refugee, is very valuable, because I can help them when I see the pain in their eyes, and always with the heart. Because if you do this only because to have some, then it's not working. They feel that if you give them love, they tell you, heal me. So all the main is with the psychotherapy is to do your work with your heart.
One more question. My name is Olga, Self-Reliance Association. Maybe the question is to Mariya. How do you cope with the problem when the person says, I want to see the psychologist in person, for example, here in Chicago, and the person doesn't have either the insurance or the insurance is HMO? How do you help them? Because I don't know, most of the psychologists, they do not work with insurance that has, for example, government insurance or very, very basic insurance. How do you help these people?
Thank you. Big problem in the United States, insurances and not covering anything. We were talking with my colleagues in Ukraine about maybe bringing United States system to Ukraine and kind of establish it there. Like, no, you don't want the insurance-based system, because it's very complicated and essential things like mental health are not covered. Well, I try to provide them with as much support as possible as their general practitioner. I try to connect them to social groups. There are psychologists that are Ukrainian speaking, people willing to pay out of pocket for that. But yeah, it's no easy answer to it. There are different resources, you just have to know your community resources. There are also parishes, churches, where you can also just talk to the priest if you are a person of faith. So yeah, just a lot of different resources and support groups. Like moms that send their kids to St. Nicholas, they socialize on their own level. And we actually have really good online groups, the Chicago Ukrainians, quite few, where people just ask questions and then get answers like who can I talk to? Can you recommend a psychologist? Can you recommend a chiropractor? And so on. So yeah, there are quite a few resources, nothing really organized, but it's case by case, and if it helps.
Please.
Sure. I want to mention, obviously the problem is so overwhelming, and we're concentrating now on the psychological effects of this war that started 2.5 years ago. But I wanted to just mention that 10 years ago, when it all started after the Maidan Revolution, and there was an occupation, there were many, many internal refugees from the east, from the occupied territory, to Kiev mostly, and that area. So at that time, there was already an enormous need for psychological help. I happen to represent the Kiev Academy, the university in Kiev. They established many years ago the Institute for Psychological Social Health. And away from the campus in a separate building, they do have a building where they are, dealing with, they don't call them patients, no, it's clients. So it's been going on for 10 years. And what's important is not only the work to help the clients, but they are doing research, keeping track, keeping data, and working together on such projects with Johns Hopkins University, Harvard School also. And I wanted to mention that when they opened offices or centers in the east of Ukraine 9 years ago, those centers had to be closed because they are now in occupied territory. So the problems are enormous. And there's something I wanted to mention that you mentioned, that it's not enough to concentrate on psychological health. And in the brand new Center for Veterans and Defenders Education and Psychological Stability, the emphasis is to bring them back to society and find employment for them, to prepare them for employment. And that is such it has to be integrated with all that work.
So I would tell you, from my perspective, a lot of what we've done through my charity, Ukraine Focus, is to look back at history and see what's worked through conflicts. One of the programs that we're actually looking at right now is the CCC, the Citizen Conservation Corps. I don't know if any of you have actually heard of it. It started after World War I when all of the million Americans came back to the U.S. After this war is over, what are all those soldiers going to do when they go home, right? I think the government really needs to think about how they integrate those veterans into a community-based service that looks beyond military. And so the whole idea behind the Citizen Conservation Corps was to look at how those soldiers coming home could be involved with the environment, right? And so we're looking at that. We're talking to the Ministry of Veterans Affairs, but there are other programs that I think that we need to consider, not just through the environment, but how can we get soldiers to get together at the most local level, whether through an American Legion, which again was formed after the First World War, the Veterans of Foreign Wars, which was formed after the First World War. It's not just a matter of putting veterans together, but also getting them to communicate, to participate, to be an active member of the community and have more of a bottom-up approach. So we're definitely looking at some of those approaches, but maybe some of you have some thoughts as we wrap up.
Can I just mention,
sure.
in Kiev at least, and I'm sure in other parts of Ukraine, for the last 10 years, there are what's called Veterano Hub. Yeah. All these hubs where not only veterans get together to talk, but they help each other find jobs, and they actually help each other to start small businesses. And you have Veterano Pizza, you have Veterano Brownies, and these are all programs supported, by the way, in part by the Enterprise Fund from the United States that really, really work.
I can add that in 2014 I was a psychologist in government program with veterans which were coming back from ATOM, but it was not so successful because of few reasons. At first, there was psychology help, but it was very short, for 1 or 2 months. It's nothing for such people. The second, they were not helping about work, about helping to find themselves in civil society. And the third, it was not working with families, because we are speaking about veterans, but the veteran, when come back home, it changed every family structure. We have to work with wives, with children, and separately pair therapy, how to find themselves in this family structure. Because even when a woman I have in my practice, which just born child, soldier came from the war to the home, and he wants to just shut down this little girl face because he tell she's shouting too much. They don't understand what to do with the man. Ukrainian society is not ready for the soldiers which are coming back. That's why we have to work not only with them, we have to work with women, with children, and with all civilian people which are in Ukraine. They don't understand what mean when people came from the war, what they have in their head. That's why it have to be just like the same separate programs.
Well, thank you very much. We're right at 3 o'clock. I want to thank the panelists, Kateryna, Anna, and Mariya. Thank you very much for being here today and participating in this very, very important discussion. We look forward to your ongoing work in Ukraine. Again, thank you very much for Ukraine for putting this panel together. We appreciate your coordination in this effort. We look forward to working with you again as we go through the next amount of months and years, hopefully not, but to try to coordinate a very, very important issue in Ukraine.